In 2002, a group of experienced specialists, capably led by Dr. Saw K. Yong, set out to open up their own sports medicine and physiotherapy unit. Their mission was to fulfill the demand for highly efficient and effective sports medicine and physiotherapy services that encapsulate more specialized and customized treatment. As the practice grew in stature and recognition, so too did its esteemed list of clients. Recognizing the need for larger space and a higher level of medical and patient care, the unique concept of the Kuala Lumpur Sports Medicine Centre was conceived, emphasizing on sports-related injuries and orthopedic surgery. In 2005, the Kuala Lumpur Sports Medicine Centre first opened its doors, attracting patients and medical referrals from all over the region. KLSMC is the first of its kind and a fully equipped one-stop centre for sports medicine that caters for most, if not all, of sports-related injuries. Ideally located in the heart of Kuala Lumpur at Damansara Heights, KLSMC is a mere 5 minutes away from Petaling Jaya and a 15-minute drive to the Kuala Lumpur city centre, with Mid-Valley just a short distance away. KLSMC provides a conducive environment for consultation and treatment, such as rehabilitation programs, surgery, post-operative care, as well as outpatient services. Sports imaging, with its state-of-the-art imaging equipment, facilitates the fast and accurate diagnosis of the numerous, diverse and complex medical cases at the centre. On top of that, a group of friendly, well-trained and highly efficient reception staff are always on hand to assist you with your inquiries, registration, scheduling, processing, as well as admission and discharge.
At the Kuala Lumpur Sports Medicine Centre, we emphasize on quality medical care. We spend a lot of time explaining to our patients their injuries so that they can manage their injuries more efficiently. We also emphasize on the importance of physiotherapy as part of the rehabilitation protocol.
All patients at KLSMC Sports Clinic are assured of highly specialized treatment, as all surgeons here, though qualified in all aspects of orthopedics, have chosen to subspecialize in their respective discipline of interest and training.
Treatment of cartilage injuries, we started medical research on cartilage regeneration, initially using an animal model, and then proceed to clinical trials on human patients in the last 2 years. Our current results using patients' own peripheral blood stem cells for cartilage regeneration are producing results which are very encouraging.
The knee joint is such an important part of our body and is yet subjected to so much of wear and tear. Therefore, it is very common to find so much problem related to the knee. My specialty is in the area of treatment of all conditions affecting the knee, which include patellofemoral disorders among the teenage age group, to ligament, meniscus and cartilage problem that involves a slightly older age group, to the degenerative condition of the knee that affects the elderly.
Low back and hip pain affect many people, and it is one of the common reasons why people go and see their doctors. Sometimes it can be difficult to distinguish between these two disorders, and here at the Kuala Lumpur Sports Medicine Centre, we offer a comprehensive orthopedic service for the prevention, assessment, treatment and rehabilitation for these disorders. We use a team-based approach to formulate a customized treatment program with the aim of getting you back to your feet again as soon as possible.
In Kuala Lumpur Sports Medicine Centre, the hand unit treats a spectrum of conditions ranging from problems involving the joint, the nerves, the blood vessels, and a wide variety of other problems including sports injuries, occupational injuries, and trauma.
From common complaints such as heel pain and ankle sprains to complex problems including severe foot injuries and stubborn bunion deformities, KLSMC provides effective and specialized treatment to help our patients regain function in their foot and ankle.
KLSMC Sports Imaging plays a supporting role to assist the physicians and surgeons in reaching the correct diagnosis. Whilst X-rays and MRI are freely available in the city, we at KLSMC Sports Imaging focus on the musculoskeletal system. We take pride in the quality of radiographs and MRI examinations. There is particular attention to consistency of radiographic positioning and specialized radiographic views.
Under the trained eye of consultant radiologist Dr. Shahrin Marikan, sports imaging was established. It features a friendly open MRI and digital radiography, with a facility to do weight-bearing full-length radiographs of the spine and lower limbs. In addition, sports imaging is equipped with a web-enabled PACS, which stands for Picture Archiving and Communication System. This stores images in a digital archive and facilitates reprints and easy review of prior examinations. It also facilitates data transfer for remote reporting and second opinions. Physiotherapy is an essential rehabilitation process, regardless of whether one undergoes surgical or non-surgical treatment. Exuding a calm and soothing ambience with large windows that provide pleasantly scenic views, KLSMC's state-of-the-art gym and exercise regimes are well suited to meet each patient's needs and expectations. At the Sports Physiotherapy Unit, highly qualified and experienced physiotherapists and occupational therapists offer a varied and diverse range of physiotherapy. Exposure to complex surgical procedures and the expertise and advice of the doctors has enabled them to better understand a patient's needs. These therapists, like the doctors, are highly specialized and can recommend the most appropriate physiotherapy customized for each patient. Also on hand is a competent team of physiotherapists who customize pool-based hydrotherapy exercises for the patient's specific needs. We have 4 operating theatres furnished with advanced facilities, which enable us to carry out various types of complex orthopedic procedures, including arthroscopic surgery, joint replacement, and reconstructive surgery. The airflow system in our operating theatres is equipped with antimicrobial HEPA filters, which enables 100% fresh air exchange and UV light that helps to minimize the risk of airborne contamination and allows the surgeon to operate under a strict sterile environment. The Central Sterile Supplies Department, CSSD, has also been set up to handle all sterilizing procedures in the operating theatres. Our 24/7 nursing care is operated by a group of well-trained, dedicated and caring nurses. Inpatient as well as daycare services are facilitated by KLSMC's 3 modern and tastefully decorated wards that offer a total of 23 beds. KLSMC has a group of visiting consultants, providing an added benefit for patients seeking medical treatment other than the services offered by the centre. Besides the in-house pharmacy that dispenses medical prescriptions, our retail pharmacy offers a variety of daily essentials and pharmaceutical products to meet the needs of patients and visitors alike. Constantly striving to be the leader in its industry, KLSMC places high emphasis on continuous research and development. Our R&D lab was set up to conduct research on stem cell harvesting, processing, storage and treatment. In 2008, KLSMC won the Nicola Award, followed by the BioInno Awards. Subsequently, in year 2009, our research paper has been accepted for publication in the Journal of Arthroscopic and Related Surgery. Today, with its highly qualified team of specialists and professional medical staff, KLSMC continues to move forward as the premier sports medicine centre in Malaysia, constantly providing a different level of care that is second to none.
It's a great place to actually come and get all your medical needs.
The physiotherapists here are knowledgeable and the treatment is good.
Stem cell helped me a lot. Here facility good, service good, staff also very nice.
Kuala Lumpur Sports Medicine Centre, redefining sports medicine today and for the future.
Good morning and welcome back. You're watching The Breakfast Show, the show worth waking up for. And today we're going to be talking about sports medicine. Now, if you think that, having a muscle sprain or a bone dislocation that you encounter when you're doing certain sporting activities, you think about, is sports medicine just for professional athletes? What do you think?
Not. Absolutely not. I mean, I know so many people, we don't have to look very far. One of our co-hosts, Nazuruddin, he has, busted his knee so many times through futsal. Is he a professional player? No, although I'm sure when he's out on the field, he berangan, he really thinks he is, so which is why the knee has happened several times. But yeah, I do not believe that it is especially for athletes only. Anyone who plays sports, has an interest, goes out running, lifts things even. I know my left hand lately has been giving me a problem just for the sheer fact of carrying my son, who is growing very, very fast, and I still think he's about 3 kilos, which he's not anymore. So, it happens, and this is why we need people who are with us on the set today.
That's right. Now, we have with us this morning Dr. Low Zichong, foot and ankle specialist from the KL Sports Medicine Centre, as well as Dr. Ranjit Singh, who is an orthopedic hand surgeon. Good morning.
Good morning, gentlemen. So you're both orthopedic surgeons, but you specialize in the hands and you specialize in the feet.
That's right.
All right, wonderful. Now, what are some of the most common injuries you find in both, hands and feet from people who are not professional athletes?
I think we see a variety of problems, and we see them in different levels. Like you were talking just now, not just the professional athletes. We see anybody who takes sports as a recreation, or even somebody who decided, look, I want to lose some weight, I'm going to go to the gym, let me do some weights, let me do some running. And when they don't understand the problems, or they don't understand their body, they tend to have injuries. And when they injure themselves, then they get worried. That's when they come and see us. But a lot of these problems can actually be prevented, providing you know what you're getting yourself into, how much of load for example, if you're going to lift something, how you're going to do it.
Like lifting your child?
Yeah. With one hand. And twisting your back at the same time. Very bad, I know. What about for yourself, doctor?
I think the most common thing for me will be an ankle sprain. I think in all my sessions in clinic, every day I will at least have a few patients who are coming with an ankle sprain. But the problem is that an ankle sprain, some can be very mild. Some of it, the patients may actually realize that within a few days they can actually, they feel better, that's fine. But I've actually had patients coming in for what they thought was an ankle sprain. It turns out they may have actually done something worse. They may have actually injured or ruptured their Achilles tendon. They may have even damaged their cartilage. And worse, I even had one that actually had a fractured calcaneum, the heel bone. So if you have an ankle injury which bothers you continuously for more than you normally would, then I think it's time for you to seek medical treatment.
Now, with regards to sports medicine, it seems a pretty relatively new concept to Malaysians. So what's the perception among Malaysians when it comes to this genre of medicine?
I think sports medicine has been there for a long time. But you're right, in Malaysia, the awareness of it is not there. And there are a few centers, and KLSMC is one of these centers where it's sort of a one-stop center where we have physiotherapists, right down to specialists, to nurses. So if you injure yourself, and if you come and go to a sports center like this, not only will you be diagnosed and treated properly, then you will be given advice on how you should be training and how you're going to prevent this from occurring in the first place. Obviously, it's better to prevent it from the beginning, and there are many things. Each sports or each sort of activity that you do, there are some do's and don'ts. But generally, I think many people forget to warm up before they do a particular sport. Everybody think they are 20 years old. They forget they're 40 or 50. You know, it's still a good age. You know, but your body doesn't work the same anymore. It is not so resilient. So you need to warm up a little bit. So that's a extremely important thing. Know what sport. If you know what sport you're going to get into, what activity you're going to do some warm up. Learn about the equipment that you're going to use. Don't overdo it. I think many of them sort of overdo it, and that's when they get into trouble. Treating it is definitely going to cost you more, and it's going to take you a lot of time before you go back to sports. So try to prevent it if possible, and that's where sports medicine come in. You know, it's not just treating it, but it's also about educating patients, educating people. Hopefully not patients, but people to prevent this from the first place.
Interesting, Doctor, because you're saying about warming up before doing any particular sports. I also find that actually cooling down after is equally as important. Would you say so?
Absolutely correct. You're right. So it's not just the warm-up part. So yeah, you're right. After you finish the game or whatever activity that you're doing in your exercise program, it's important to what we call cool down. And especially if an area of your hand or your elbow is prone or you've had injury before, you want to ice it down. So that's part of what you're saying, you're cooling it down. So icing it actually helps to prevent it from swelling up or giving you pain and discomfort later. So ice it immediately after the game, just ice that area, especially that area that is prone to give you injuries.
Right.
So that's an important concept to understand.
And stretching as well to elongate the muscles, would you say?
Sure. So warming up, one of the things that you do in the warm-up is to practice the certain motions that you're going to go through. Stretching is really important, stretching those ligaments, those muscles, warm them up. The idea is the more you warm up those muscles and those ligaments, the more stretchability there is, the less likely they'll get into a problem than a non-warmed up muscle or a joint or a ligament.
What do you usually notice of the demographics of the kind of patients you get? Any particular background that you notice is dominant, or is it fairly general?
I think we get patients from all ages, all races for that matter, and even all income groups also. Although yes, those who want to recover faster, they will definitely come and see us. In fact, taking up on this thing about the ankle, about
in fact, you're saying, Dr. Loh, just witnessing what we're actually looking at the footage at the moment is something about ankle. So this is a foot injury, common pretty much with people practicing sports?
Certainly, yes, very common.
That looked very swollen just now. It actually, yeah. So I mean, in a case like that, I mean, what is the best thing to do? Still ice?
Oh, well, ice is one thing, but as I said, taking up from what Ranjit said just now about prevention, you see, especially for ankle sprains, a person who has had an ankle sprain like that, at some point will still need to undergo some physiotherapy and rehabilitation. And the sole reason I find is that it benefits a lot in a way that it prevents them from a future injury. Because without going through that, the ankle remains, the muscles that control it are weak. And then they actually, the story I always get from my patients is, Doctor, I sprained my ankle last year, and now this year I notice my ankle just keeps giving way every now and then. For the ladies, the problem they get is they can't wear high heel shoes.
Oh dear.
So
the physiotherapy part we do find is very important. It helps to prevent future injuries, and of course generally improves your function.
Now, there's generally, from what I understand, there's two types of injuries. One are the impacted injuries, where you know for sure when and how you did it. For example, you fell down the stairs, you stood up, and suddenly your ankle hurts. Okay, we know that was an impact injury. And there's also the overuse injuries. For example, wearing high heels 20 times a day, you know, 12 months of the year. How do you treat is there a different way of treating these two types of injuries, or is it the same?
It's different because they're both different sort of pathology, they're different etiology, they're different mechanisms. So the overuse is the one that we commonly would see, and they're more difficult to treat because it's not one particular trauma, it's over a period of time. For example, tennis elbow. If you continuously play that game without warming up, without stretching, without strengthening this group of muscles that are important. If you don't have a strong strong backhand, then you have a lot of problems with the elbow. So to treat them is different. Whereas an impact injury or acute trauma is easy. There's a fracture, there's something you've torn, just fix it, rehabilitate it, they go back. But a repetitive injury continues to happen, so you have to educate. You educate the person who is doing it. You have to then strengthen those muscles. You have to be careful with the type of racket or the equipment that you use, for example. So there's a whole lot of things. It's actually a little bit more difficult.
Yeah, which is why I notice even for me, my wrist, it's something that keeps coming back.
I see, you feel
Yes.
it. Now, doctor, when it comes to muscle sprains or even shin splints, a lot of times people would say, I'll just let it go for a few weeks, and see how it goes.
It'll be fine.
It'll heal by itself.
Yeah, I'll be fine.
Yes. So what do you say to that? Because sometimes it does work.
Well, like I said just now, if you are quite strong to begin with, a patient, I noticed that patients with ankle sprains, they tend to recover faster. I mean, if they have strong right at the beginning, I think sometimes the ones that have more problems with those weekend athletes, we call them, and they just, happen to injure their ankle, or even like the case of a shin splints, they may have just tried a new pair of shoes and then found that it's not right. So sometimes I think the advice is this: if you have symptoms that persist for more than a couple of weeks, I think it's time to get it checked out.
But shin splints is also a very common overuse
Yes, it
injury.
is.
It's when the calf muscle becomes too tight and starts to pull on the
Well,
tendons.
partly is due to that, but also partly is also the shoes that you use and the activities that you do. A lot of it is due to what we call pronation of the foot, where the foot turns in. So, for example, if they run around,
Oh dear.
That looks very painful.
Oh dear.
Ow, 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 poor guy.
So that one would take how long a time to heal?
well, I can't say for sure. We have to bring him in and do some tests on him, and then only we have an idea.
Right.
Yeah.
Now, doctor, there's a certain advanced treatment now for bunions, which happens to be a very common thing among women, especially women who wear heels. So tell us about this very briefly, this advancement.
Well, currently now the techniques have improved. We have new ways of reshaping the bone. So if you have a bunion, we can actually do it in such a way that the pain, the post-op pain that used to plague a lot of patients is a lot less, and the mobility is better. A lot of our patients nowadays, the next day after a surgery, they can start walking. Although I would say you need to be using a certain type of special shoe to wear. But generally, because of the improvements in these techniques, the acceptance and the willingness to go through this surgery is a lot more.
Right. Okay, finally, before we let you guys go, just one last question. Dr. Ranjit, what is the difference between sports medicine, say for example you have these injuries relating to sports, to go to a sports medicine center as opposed to a regular hospital?
Oh, you see, the whole team in the sports medicine, for example, in KL Sports Center, they're all geared towards a person who wants to go back to his activities. So it's not just one person that's involved. It's not just a surgeon. There are the therapists involved. There are trainers involved. So that it's a journey that you take. So if you have a team that is focused in trying to put you back to the sports, to the game, especially if you're a high-level athlete, then you want to go to a setup where everybody is sort of on the same page. So a little bit more details, a little bit more what do you call this? Special care is given if you go to a sports center.
Okay.
Fantastic. Well, thank you so much for joining us here on the show. It's been very, very insightful. I might have a little chat with you later about my wrist as well. Now we're going to go for a quick break, but stick around because right after this, we're going to be talking about retirement plans.
That's right, you're back on Daybreak. My name is Raj together with Robin, and today we have a special guest who's going to talk a little bit more about sports medicine, in particular orthopedic surgery. And he is none other than Dr. Saw Kay Yong, the orthopedic surgeon from Kuala Lumpur Sports Medicine Center. Dr. Saw, thank you for being on our show this morning.
Very good morning to you.
Good morning.
Right. Now, as we always do here on Daybreak, before we dive into the nitty-gritty, we always like to find a little bit more about your personal background and also a bit more about Kuala Lumpur Sports Medicine Centre.
Yeah, I mean, I was born in Penang, so
Right.
I'm a Malaysian, I'm born in Penang. And for the first half of my education, until when I was 16, 17, I was in Penang. And from there, I went to boarding school in the UK. That was before the university. And from boarding school, I went to Liverpool University, where I did medical school. And after graduated from medical school, we have different options of what you want to do. I mean, when you go through med school, you need to decide, do I want to be a physician? Do I want to be a surgeon? If I want to be a surgeon, what type of surgeon I want to do?
But then when was the decision when you wanted to become a doctor?
Yeah, when I was young, I was always fascinated by the human body, how things function. You like biology, you dissect animals,
Frogs.
or frogs. And then you look at the nervous system, you look at the musculoskeletal system, and you're intrigued by how all this works. And then
So it sort of sparked a curiosity at a very young age.
And then
right?
when you are sick, you want to know how you recover.
Yes.
But when I went to boarding school, I had a choice of, at that time, I'm talking about late 70s, you have to look at your career. I mean, I wanted to do medicine. My parents wanted me to do business, but I also like engineering. I like various aspects, different things. So I had various options, but I thought, okay, let's try for medicine and see what happens from there. So when I got to med school, you're exposed to all these different subspecialty, So you have psychiatry, you have general medicine, you have gastroenterology, you've got orthopedic surgery, general surgery, neurosurgery, all that.
It's probably thousands, is it?
Yeah. But I knew very quickly in my medical school days that I'm not cut out to be a physician. I'm surgical aspect is where.
You feel like you need to be more hands-on.
Yeah.
Pardon the pun, obviously.
And if you look at all the different personalities that make up the different type of doctors, you see it's the personality. Right?
Yes.
And surgeons are patients, doctors who are more hands-on. So as a child, we like to play with a mechanical set. We like to take things apart, put things together. And so it was fantastic when I did orthopedic surgery. If you know orthopedic surgery, we do joint replacements, we do knee replacements, and we have, very specialized power tools, screwdrivers, we have chisels, it's like carpentry, but a very high-tech carpentry.
Right.
So you can then have the option of doing what you like to do hands-on, carpentry is in a way, but also
it's a lot more delicate, I'd say.
scientific way of doing things. So with a medical training, you have
Sounds like a big kid with nicer high-tech toys nowadays.
Pretty much.
That's right.
Right.
That's right.
Fantastic. Now, moving on to current times, can you just tell us a bit more about Kuala Lumpur Sports Medicine Centre?
Yeah, I mean, Kuala Lumpur Sports Medicine Centre is a concept that we started up more than 10 years ago.
Okay.
At that time, myself, Dr. Tay Yong Guan, my other colleague, and Dr. Shari American, he's a radiologist, and three of us were working in Gleneagles Hospital in KL. The problem we had was that we wanted to do things quickly, and sometimes major hospitals have got restrictions for what you can do, and we were getting patients from abroad and patients from Indonesia coming in, and it's very difficult for patients who come in to see you, and you tell them, yeah, you can see them, you can examine them, but I'm sorry, I can't do an MRI scan today until 2 days or 3 days later.
Because it's like a waiting list, you have to make a schedule an appointment.
Yeah. Because they're foreigners, they have to travel back to their countries later on, and this and that, so it's a huge burden.
It's very difficult as a patient, and if you want to treat health tourism patients, it's impossible to do that. So we thought, between me, Dr. Tay, and other doctors, why don't we do something different?
Right.
So the concept of KL Sports Medicine Centre, we conceived the idea having coffee in the morning, and basically we wanted things that we can do quickly, and we wanted a very structured way of doing things with collaboration with nurses, physiotherapists, patients, and all that. We wanted things that's integrated.
Right.
But major hospitals, they don't look at things differently, so we are more like a boutique place that we can do things very differently, but more efficiently and quickly, and produce a quick
Now
result.
the big question is, why sports medicine in particular?
Yes.
Yeah, you see, if we just call ourselves Kuala Lumpur Orthopedic Centre or something, it doesn't differentiate us to give us a branding.
Sure.
So we wanted something that people can identify, what we do, and each of us saw different problems. After a while, we wanted to do subspecialty work. So in the early days, we were doing trauma, we were doing on-call, we were fixing fractures in the middle of the night. We were also seeing knee problem, ankle problem, back pain, hand problems and everything. And then we started working with like-minded people, So we had Dr. Ranjit in, and he's a hand surgeon, so he's interested in hand. So we could send him all the hand problems to see. And then we had Dr. T.C. Lau, who is a foot and ankle surgeon, who now treats all our foot and ankle problems. And then we have Dr. Eman Ong, who
So
does
basically, in the
spine
center, you have all the doctors that cover different sections of the body at one place.
At a different level.
At a different level. That's fantastic, Raj.
So if you look at the future, if you look at the West, for example, you look at America, you look at the UK, there's always people who do subspecialty work, And like, if you see a hand surgeon like Dr. Ranjit, he can see a simple sprain to microsurgery to an amputated finger, a wrist, and replant all that. So, so the depth of knowledge, it's so vast, and this is what you need for subspecialization.
Yeah, I think that's very crucial. Now, one thing is, we know that private hospitals, they are huge, and don't they also have their own like sports medicine division to handle all the different situations you have mentioned just now?
But most of that sports medicine work is under the umbrella of orthopedic surgeons.
All right.
So if you go to a major hospitals, you will see 20 orthopedic surgeons there, and some may put interest in shoulder or knee or whatever, or hand or whatever, but it's not as developed as what we are doing as a group.
Yes.
And we have the physiotherapy rehab as well, in addition to that.
Because you have the time, you have the sources, and also because it's like
because we're small.
Exactly, it's easy to control.
It's easy. And we are small. We are the pioneers, and we had ideas of what we wanted to do. And all my partners, we've been abroad for many years, and we've been back, and we've traveled a lot. So we see different ideas from different parts of the world, and impart our own ideas of what we think, what we like to do.
So you can actually come back and implement it straight up, just by yourself.
That's right.
Yeah. Which you cannot do in a hospital, per se.
It's not you can't do it, it's just a bit more difficult to do it.
I see.
Bureaucracy, red tape, and approvals and all that, I would imagine. Now, speaking of that, when you set this medicine center up, I would imagine the investment, the initial startup cost would have been truly immense, given the fact that the cost of equipment, machinery,
equipment alone, I can imagine.
Yeah, I can imagine. Talking about in the millions, right?
Yeah, I mean, when we conceived this idea, everybody thought we were crazy. And but we had our accountant to advise us, and we look at the sums, and we look at we were not doctors who just starting out our practice. We are more or less established. We have patients, that can come and see us, whatever. But there's always a risk. I mean, you can't try to do something without risk, but it's a calculated risk.
Of course.
So what are you going to get at the end of this, or do you just want to stay in your comfort zone and not progress? I mean, and it's like everything else. It's like medicine. It's like your career. What you want to do? Do you want to travel? You want to do different things?
Exactly.
But if you don't push the frontier of medicine, like what we're doing, stem cells and everything, then you're not going to get to the next level.
Okay. Well, I have a question. Let's say if I'm a patient, all right, I've got a slip disc, all right, so I go into your institute, what happens? What are the processes? Knowing that it's very efficient, very effective, so I want to know exactly what are the processes.
So if you have a slip disc, you come to our office, we will refer you to Dr. Eman Ong, our spine surgeon.
Okay. So I walk in and I see the doctor straight away?
No, if he's not there, one of us will see to you. It's not an issue. I mean, we're all general orthopedic surgeons. We can do general orthopedics, we can do fractures, we can do lots of things.
Because you understand it all, basically.
Yeah, but we've chosen to do a subspecialty work. But when you come in, eventually you'll see the consultant who looked after your spine, and the likelihood is that he'll probably ask for an X-ray, and if not, an MRI scan as well, after taking a history from you and examination. One of the things that I find that is as a lost art now is the art of practicing medicine. That is something that patients sometimes do not realize. Now people depend a lot on images, X-ray, MRI scan. They think you can diagnose everything, but it's not, and it is still the art of taking a history from patient examine the patient properly, do a neurological examination, and then come up with a differential diagnosis without even looking at X-ray, MRI.
Basically,
tests.
engaging with the patient, asking questions,
That's right.
which is more important,
And
rather than relying
examining-
on just technology.
And
Personalizing
examine
the
patient.
experience.
Yeah, and that is the art of medicine that I see that unfortunately is lost somewhere in transition.
Yes,
because
you're
of
right.
modern technology. That's a
Yes,
shame.
yes,
Because that art of
yeah.
medicine is not something that you can read from the books,
That's
and it's
right.
taught by consultants that you've
Yeah.
attached to.
I mean, you said here
through medical
somewhere
school
that
and everything.
happy patients heal faster. Right?
Definitely,
Yeah,
definitely
yeah,
makes
yeah.
sense. All right, Dr. Saw, just hold that thought for a moment.
Yes.
As you can see, we have gotten a little bit insights with regards to what sports medicine is all about, in particular orthopedic surgery. Now what we're going to do is we're going to take a quick commercial break. If you have any thoughts, as always, you can email us at updates@Capital TV or tweet us at the Capital TV right now. Now, when we come back, we're going to talk about something radically new, taking the world by storm in the world of medicine, which is stem cell research. Now, to find out more, please stick with us here on Daybreak.
Good morning, guys, and welcome back to Daybreak here along with me, Robin Conrad, Raj Arya, my co-host, and Dr. Saw. Yes?
Yes.
So, okay, moving on now. We're talking a little bit, we'll get to the specifics now, yeah? We're going to talk about what really happens, not even on an atomic level, well, rather actually on an atomic level, about stem cell research.
Cellular level.
Cellular level.
To be more accurate, cellular level.
Cellular
That's right.
level.
Yes, much more organic. So tell me how this whole thing was brought about. I know it's been brought about. The whole development happened since 20 years ago or so, and that it's just different institutes working, working to develop stem cells. But what do you do? How do you use stem cell research in your practice?
And what is basically stem cells?
Yeah.
Our viewers out there.
Yeah, I mean, simple thing just to describe about stem cells first. Actually, stem cells are actually our building blocks for our organs, our human being. So if you think about an embryo, when you have a sperm and an egg, and when that's fertilized and cells start to replicate, you have embryonic stem cells that then differentiate into different tissues, from bone, from heart vessels, to blood vessels, to different joints, to the brain, and everything. So the embryonic stem cells, if you think about it, it's like a wild child. You know, that child can develop into different professionals.
Right.
Okay, but the problem is that it's very difficult to control, and if it goes wrong, it goes very wrong. It goes into tumor, cancer, and everything. So
Wow.
So
It's
you
very
know,
delicate.
people are very concerned about embryonic stem cell research, but adult stem cells is different. You know, the stem cells we're using. You have bone marrow cells that you can take, you know, and that's been around for a long time. If you see orthopedic surgeons, the bone don't heal because of a fracture. They take bone marrow, marrow graft and put inside there. But you know, for many years we've been doing that. But while we are doing that as orthopedic surgeons, we don't know. We thought it's the bone, but it's not. It's actually the cells that's in the bone marrow. So it's like bone marrow stem cell. And that's been around for a long, long time. If you remember. 30 years ago, when the hematologists, the blood specialists that treat blood disorders like leukemia and everything, and what they do is that they take bone marrow, and it's called bone marrow transplant.
That's right.
Okay, so for example, you have an individual who has bone marrow problem, disease, or whatever, leukemia, whatever, and then you can have either take their cells, if not, take a donor cells, which is HLA compatible, harvest the bone marrow cells and transplant into that individual, and to help to repopulate the bone marrow cells and cure the disease to a certain extent. All right, but that was 30 years ago. In the last 20 years, because it's difficulty of getting bone marrow cells and everything, the hematologists have moved on to do a procedure called peripheral blood stem cells. You know, so they mobilize the stem cells from the marrow by giving injections called GCSF, okay? And these are the injections that mobilize the cells from the marrow, replicate the cells, and then they go into the bloodstream. So once it goes to the bloodstream, you have all these stem cells in the bloodstream. It's like lots of fish in the river.
Sure.
And then you have a machine, which is what we use for apheresis process.
Right.
It's like a centrifuge the cells that you want, and then return the blood cells and the plasma to the body. And that's the process that we do for our cartilage work research.
This is how you harvest the stem cell?
That's how we do, it's a peripheral blood stem cell. But then there are other people who do cultured cells. So for example, there are companies in Malaysia as well, they'll take individuals' marrow cells and they put it in a petri dish, and with various growth factors and everything, they will replicate those cells, and that is cultured stem cells.
Right.
Cultured mesenchymal stem cells. And also, sometimes they use a single donor and give it to other patients. So this is called allogenic cells. That means that the cells is not coming from the individual patient. The cells that we are using is patient's own blood stem cells.
Right.
Okay.
So can you give a description? You're using our
your beautiful display.
display of the knee here in terms of how you use stem cells with regards to regenerating the cartilage.
Sure. I mean, this is a model of a right knee joint. Okay. So that's a front view, and that's a side view, and you can see that's a kneecap there. Right? And in all the joints, what you have in the joints is that you have articular cartilage. Okay. Now, articular cartilage, if you look at a leg of lamb, you see that white piece of cartilage in that joint.
Yes.
That is the cartilage. If you remove that cartilage, it's down to bone.
Okay.
All right. So in any joint, this is for example a knee joint. What you have is that you have cartilage there on two sides of the joint. But when this cartilage wears out for whatever reason, either sports injury, trauma, or whatever reason it wears out, patient will have pain because this cartilage, the normal cartilage, has got no pain fibers. And it's got no blood supply as well. So because it hasn't got blood supply, it cannot undergo repair.
Yes.
If you cut yourself, you bleed and you can repair. If you break your bone, the bone will heal because
basically where there is blood, there can be repairs.
That's right. Yeah. But the cartilage, because it does not have blood, it does not repair. So this is a model that shows cartilage damage there. It's damage is down to bone. And when you have this, you have pain because when you walk on raw bone, it's painful, it's aching.
So it's like the bones are grinding together. There's the friction and all that. That's how you have knee pains, joint pains, and all that.
It's bone on bone, and that's why it's painful. You know. So for if you look at the history of people wanting to regenerate this cartilage and try to make it into normal cartilage, there are lots of methods of doing it throughout the years.
Sure.
Okay, but what we are doing is something different. Okay, for many years. A very standard procedure that orthopedic surgeons do is actually doing keyhole surgery called arthroscopic surgery. That means that you put a camera inside there and you look inside there. Yeah. And that's what we do as well. And there's a technique called microfracture technique, which is popularized by Dr. Richard Stamen in Vail, Colorado. And what he does is that he does some picking into the bone with a little mallet and a bone pick and make little holes into the bone. And by doing that, the cells will repair to a certain extent, but then the repair tissue, unfortunately, is not a normal hyaline cartilage. It's actually a fibrocartilage, which is a poor quality cartilage. So, if you look at your cartilage, it's like your tires. You know, you wear your tires, and you want to replace it with a good tire, or you want to replace it with a poor quality tires that do not last. So, microfracture unfortunately gives you poor quality cartilage. And for many years, I've been doing drilling instead of microfracture, and we've been supplementing it with giving hyaluronic acid injection, HA injections. These are the building block for cartilage, but it's got no cells. But I was getting variable results, some good results, some poor results. So 7-8 years back, we thought, can we just drill and put stem cells and HA and regenerate good cartilage, you know? And that's when we look at animal model because we wanted a proof of concept. You know, you can't just go ahead and just do human.
No, of course not.
And so we collaborated. We collaborated with UPM Veterinary Hospital. We did some animal goat model, and we created defects. We used various ways: a control group, a group with HA, a group with stem cells, and we found that the group with stem cells regenerated very beautiful cartilage. And at the same time, the Singaporeans did a model. In a porcine model that they did marrow cells, they cultured, and they also grew beautiful cartilage. So a different way of approach, but we got the same results, you know. So from there, we progressed into clinical trials. So we started doing keyhole surgery, drilling into the bone, and from there we harvest the peripheral blood stem cells and inject into the knee joint, and we follow up our patients. So in the last 6 years, I personally have done about 450 cases now.
Wow!
And we've followed them up, and we've also taken second look arthroscopy, opportunistic biopsy, that we take biopsy from a repair cartilage, and found out that we can get very beautiful cartilage, which is very much similar to a normal cartilage.
Doctor, I'm really curious though, right? Because when you do these procedures and operations, there are always risks, yes? But I want to know, what are like the success rates? Like you have a lot of patients come in, and sometimes they work out, sometimes it doesn't work out, this and that. So what is the percentage?
When you look at your results, when you look at doing something new, stick to the principles. I mean, medicine, you have surgical principles and everything. So what we do is that there are lots of things you need to assess before you start doing your surgery. You want to decide, do you have patients who's very bow-legged? It's like you driving your car, the tire is not aligned. If you're bow-legged, the cartilage wears out. If you try to regenerate cartilage in that joint, it's not going to work unless you realign the leg. So it's a complex procedure. If you've got a ligament problem, you need to address that. Sometimes the kneecap don't sit in the middle, and you need to address that as well. But if you put all that together and we look at our long-term results, yes, you have good results and you got not so good results. But the fact that you stick to surgical principles, the drilling procedures are standard orthopedic procedures, but we've refined that technique, and in publications we've shown that. And also stick to cells that that has got long history. So if I start using some cells from animal origin and inject into a human joint, you can't do that because you don't know the cell origin.
True.
But we are using stem cells that's been around for the last 20 years. And the peripheral blood stem cells has been transplanted from individuals to another patient who needs that. And that process through a blood transfusion has been around for a long time. So we use cells that we know. But yes, there's still potential problems. And that's why we are looking at our long-term results now. We are looking at our phase 4 results now, where we are taking our patients back 3, 4, 5, 6 years. We're doing an MRI scan for them and look at, is there any synovial tumor, any abnormal bone tumors that formed from all this?
Right.
So yeah, but as I said before, frontiers of medicine, you have to push the boundary.
Right.
But then you have to be cautiously optimistic as well.
All right, Dr. Saw, speaking of pushing the boundaries, with regards to Kuala Lumpur Sports Medicine Centre, what's in the pipeline right now going forward into the future? I understand that you're also positioning it as part of attracting patients from overseas as well, very quickly, just to sum it up.
Very quickly. I mean, we have, because of the niche work that we do, we have a lot of patients coming from abroad just for this treatment, okay? And the Malaysian government is very keen to look at this technology and support the technology and to make this available worldwide and share knowledge with our American colleagues and our British colleagues. So by doing that, the Malaysian government realized that this is where it's good for niche practice, good for health tourism, good for biotechnology of Malaysia.
Yes.
So the government is fully aware of what we're doing and fully supportive of what we're doing.
That is fantastic.
And is very keen to see how they can support a worldwide trial funded by the Malaysian government.
Well,
so that's in the process of discussion at the moment.
Fantastic, and it's all in the backyards of Malaysia itself. So for those of you who are suffering from sports injuries, as what we've been discussing right now, all you need to do is to pop over to the Kuala Lumpur Sports Medicine Centre, which is in Damansara Heights, right?
That's right.
That's right, just a stone's throw from here. So you can have yourself checked out by Dr. Saw or one of his colleagues, and who knows, you could be almost as good as new. Now, of course, if you have any more questions, you can still email us at updates@capitaltv.my or tweet us at @capitaltv, and we'll be more than happy to forward your query to Dr. Saw. All right, that's all the time we have for this particular segment. Dr. Saw, thank you very much for being on our show. It has been most informative. And right after the break, we're going to talk about a special event which is just taking place earlier this week, which is called Culinaire Malaysia 2013. So stick around to find out more right after this break.
Stem cell research is beginning to show credible promise in treating various medical conditions. At Kuala Lumpur Sports Medicine Centre, KLSMC, Our success in stem cell therapy for articular cartilage regeneration, especially for those with knee problems, is a result of an extensive research and development program. If you decide to undergo stem cell therapy for articular cartilage regeneration, our orthopedic surgeon will assess you clinically, taking into consideration of your medical history. Medical examination includes X-rays and MRI scan to assess the suitability of your condition for stem cell therapy. An arthroscopic keyhole surgery will be performed on your knee. The aim of the surgery is to remove damaged cartilage and create small drill holes into the damaged area. This procedure will take approximately 2 to 3 hours under anesthesia. Further procedures may be required if meniscus or cruciate ligament injury is present. You will be required to stay in our ward for a minimum of 1 day. Following surgery, physiotherapy will be initiated involving continuous passive motion of the knee for 2 hours every day for the first 4 weeks. 1 week after surgery, you will begin the harvesting procedure in our day ward. 3 doses of Neupogen, which is recombinant GCSF, will be given to stimulate your bone marrow to increase the production of stem cells. This will be administered under the skin of your abdomen daily for 3 consecutive days prior to the harvesting procedure. Side effects from the injection are generally minimal and may include rash, bone pain, headache, and occasionally redness and discomfort at the injection site. On the day of the stem cell harvesting, you'll be required to take 2 calcium tablets with your breakfast. A gown will be provided upon admission. A doctor will utilize an ultrasound machine to locate your femoral vein at the groin area, and local anesthesia is then administered. The apheresis catheter is then inserted into the femoral vein. Once the catheter is inserted, your blood sample is taken to determine the number of white cell counts. This double lumen catheter will allow blood to flow from the femoral vein into a blood cell separator. The blood cell separator creates a centrifugal force to separate the various components of the blood, like plasma layer, buffy coat, and the packed red cells layer. After separation of the blood components, the stem cells layer is harvested, and the rest of the blood components are then returned to the body via the double lumen catheter. Complications are minimal. However, some patients may feel lightheadedness, especially at the beginning of the procedure. To prevent blood clotting, an anticoagulant, such as an acid citrate dextrose, is added to the cell separator. This may result in symptoms of pins and needles in the fingertips or lips, palpitations, or a feeling of being unwell. These symptoms can be minimized by the calcium supplements taken prior to the procedure. Harvesting process takes 2 to 3 hours, during which you may read a book or have a light meal. When the harvesting process is completed, the catheter will be removed and a light dressing will be applied, which can be taken off in the evening. You will be placed on a head-down position for 10 minutes, following removal of the catheter. This is to minimize bleeding at the catheter site. After your stem cells are collected, it will be sent for processing in our laboratory. 8 milliliters of your fresh cells will be separated for immediate use, while the remaining stem cells are labeled and cryopreserved in liquid nitrogen at -196 degrees Celsius. The fresh stem cells will be mixed with 2 milliliters of hyaluronic acid for your first injection into the knee joint. Before injection, your knee will be iced to reduce pain. Antiseptic solution is applied onto the injection site. There may be some discomfort following injection of the stem cells. Excessive activities should be avoided in the first 24 hours. You are required to have a family member or friend to drive you home. In the subsequent 4 weeks, additional stem cell injections will be given weekly. Our technique in regenerating articular cartilage of the knee is simple and can be performed arthroscopically in a single procedure. It is possible to treat large defects, multiple defects, and kissing lesions of the joint. Our early results lead us to the conclusion that cell therapy will have an integral part in the future treatment of cartilage damage, as well as other potential orthopedic, surgical, and medical applications. Kuala Lumpur Sports Medicine Centre, redefining sports medicine today and for the future.